And welcome back to the Ask the Hair Guy show, where we answer questions that come to us organically from behind the hair chair. And today we're talking to the beautiful Dr. Alita Sikora.
Thank you.
And those of you that follow me on YouTube know that I've been doing segments on the best things in Vero and Indian River County. And this is one of my favorite doctors of all time because I mean, I guess it's obvious it's in the name of your company. It's innovative. She does innovations. She does all kinds of cool stuff. But I couldn't help but notice, I follow you on Instagram, and you went to a seminar recently about hormones.
Correct.
And it struck me because from behind my chair, women all the time were talking about hormones. I guess I cater to a gal of a certain age, and but you touched on many things that we actually talk about, like low energy, lack of focus, sexual dysfunction, weight gain, anxiety, poor sleep. And so I just wanted to touch base with you.
Sure.
What is this new thing that you went to the seminar and you came back and you were on fire as usual? She's very excited about what she does.
So I always enjoy learning. I've actually been using hormone therapy. It's bioidentical hormones that are more natural to mimic our body's functions. I've been doing this for a long time.
Is this like something you inject in us? Is this a prescription we take home? What is this?
So this in particular are hormone pellets. Those are very little, they're little, almost like capsules that are inserted into your fat in your buttock, and they stay in for several months.
And just sort of dissolve over time. Okay.
So then you don't need to take anything orally or there are other options. You can get hormone creams and patches that you have to do every day. You can get lozenges that you would do at night for progesterone and testosterone.
Sure.
But it's a combination. Like a lot of times I'll do estrogen and testosterone in a pellet. And then ladies will take progesterone at night because it can really help with sleep, and that they would do orally.
See, and this is one of the things that they talk about a lot, is that their sleep patterns are interrupted.
Yes.
And even sense of depression.
Absolutely.
From, I don't know if it's, I'm not a doctor, people. I'm a hair guy. But I was assuming that when you don't get enough sleep, you kind of
that affects
can
our
fall
cortisol, which is a stress hormone. That affects multiple other functions in our body, our immune system, I see a lot of people with chronic pain. Once you balance hormones, a lot of the other issues may go away. And the hormones are going up and down like this in perimenopause, which can go on for over 10 years. So you'll have highs and lows, and I'm just kind of starting with this. So I'm getting the fatigue, the insomnia. So I'm about to do my own hormone panel and start a little progesterone at night.
Panel being a blood test?
It's a blood test. Okay. So yes, we would do your labs.
And is that done in office?
Either in office or at any lab, Quest, LabCorp. And it's not only for women, just so you know. Men also have low hormones and get hormone therapy. Men usually get just the testosterone. But, it's not just for men.
And it's also pellets?
You can do pellets. You can do creams, injections, the lozenges. That specific conference I was at was about the pellets. The pellets are nice because you don't have to worry about it. And actually, men go longer. Men can go 5 or 6 months even without needing more. So the women usually come every 3 to 4 months when we do pellets. So the nice thing is you don't have to worry about doing something every day.
So let me ask you the ugly questions. Any of this covered under insurance?
Not this. The bioidentical is more natural, mimicking your body. Some hormones would be. Those are more like estrogen pills that you would get like from a gynecologist. The reason I don't is there have been concerns about cancer with estrogen. I'm sure you've heard about that.
Well, this was on my list of things to talk about. One of the things my ladies talk about a lot was some of them have tried some things in the past and developed like cysts in the breast. Now, none of them turned out to be cancerous, but it certainly raised red flags, and many of them stepped back from it.
That's a valid concern. Yeah. Absolutely. I mean, so back in the early 2000s, there was a really big health study called the Women's Health Initiative, and that's where it came out that estrogen is bad, and don't take it. That there was a big thing. A lot of women got pulled off of hormones. That was not the hormones I'm using.
Okay.
That was called Premarin, which is from horse urine. They take the estrogen from horses, and it's very strong, much stronger than what we give people. These are plant-based. And then they also found there was a certain kind of progesterone that was also really bad. We don't use any of that. So there have been other studies now. Transdermal or on the skin estrogen is actually protective of some cancers and heart disease.
Really?
The specific kind of progesterone.
I was just going to say, I'm hearing a lot of different applications, pellets and patches and creams and shots and whatever.
Well, that's why we don't do the oral, that oral estrogen.
I take it then the price points are all over the board then.
So yeah, if you want to get that oral estrogen pill, you can probably get your primary care to write it and your insurance would cover it. But that is the one that, that has
the scarier one.
So yeah, these are not covered. They're considered, you know, they're more experimental. They're not FDA approved.
Or as we like to say here at Dr. Alita Sikora's office, innovative.
Yes, innovative. But yeah, these, you know, and that's why I go to these courses to learn about the risks.
Sure.
I personally would not do an oral estrogen pill that would, and the other thing is those are very high doses. So yes, at high doses, you can get estrogen and progesterone to come out of balance, and that increases the risks for those cysts. When I do the pellets, I start people with a very low dose.
So question, and I'm going to pick on my lovely wife behind the camera. So let's say Stacy is a woman of a certain age, got that perimenopause thing going on. If she wanted to say, try the pellets or whatever, can you do the pellets and see how it goes? And if it doesn't suit you when it wears off, just let it wear off? Or is there a weaning process? Or?
Once they're in, the hormones are in, which is why the first time we get your labs before, see where you are. Some people are already on another kind of a hormone, maybe the cream or the patch I'm talking about. So that would all affect the starting dose. Then we, you know, that usually takes some time before you feel the effects. They peak at 3 to 4 weeks. So that's when you really notice, oh, did my libido get better? Did my energy improve? I get another set of blood work to see where the labs are again. So to see, did you increase enough? Would we want to give you more next time? And yes, if you tell me that, you know, it's not for you, you know, then you just don't do it again.
Sure.
Or maybe you decide that, you know, oh, I would rather do a cream every day. I mean, that's...
So there's no harm done in trying?
No. I mean, there are different options.
Excellent. So, all right. Obviously, I can't cover all this in a few-minute video, but tell us how we get in touch with Dr. Alita Sikora. What's the number? Where are you located?
Our office is right near the hospital. It's 1255 37th Street, Suite B. The phone number is 772-228-6882, and it's www.sikoramedical.com.
All right, and I'll put that down in the comments below.
Thank you.
Don't forget to like and subscribe our videos on the little buttons wherever they are on the screen. And again, one more time with Dr. Alita's phone number.
772-228-6882.
Because my next question is if I wanted my wife's libido to be higher. Anyway, that's another video.
Tell her to come see me.
Thanks for tuning. She'll be here. Thanks for tuning in to the Ask the Hair Guy show and the beautiful Dr. Alita Sikora.
It's not just for ladies.
And it's not just for ladies. I am pretty certain that we'll have more reports on this one. Take care, guys.
Thank you.